What we're looking at here is we are looking at the scapula, and this is the first bone of the upper limb. Okay, it attaches directly to the posterior aspect of the spine of the rib cage. So when you're looking at the scapula, what you have to do is first orient yourself. Are you looking at the back of the scapula, or are you looking at the front of the scapula itself? So if you can see the spine like this, so if you're looking at the spine, this is the posterior aspect of the scapula. Here, this is the anterior aspect of the scapula. Okay, here, this is the lateral aspect. This is lateral scapula. This is medial scapula. So if you look at it, this is how it will orient itself on the body. So the structures of the scapula, we have the spine of the scapula. Okay, this is the spine. The structure right here is the spine. And the scapula itself, the spine, what it does is it turns into the acromion process. The acromion process right here. 22 off. Below that, here, we have the coracoid process. The coracoid process right here. Okay. Down from the coracoid process, we have the glenoid cavity. The glenoid cavity. Okay. So we have spine. Spine turns into the acromion. We have the coracoid process. Then we have the glenoid cavity. Using the spine as our point of reference, we have a bunch of fossa, which are muscle attachment areas. Okay, above the spine, we have the supraspinous fossa, and what's really cool is there's a muscle called the supraspinatus. It sits in there. Below the spine, we have infraspinous fossa. The infraspinatus muscle sits in here, and then we turn this over, we have the subscapular fossa, this whole structure here, and the subscapularis muscle sits in here. And those are three of the rotator cuff muscles, sit right on this bone right here. So this is the scapula. You are no longer allowed to call it the shoulder blade. It is our scapula. So again, looking how it's going to be oriented on the body, do you need to know if it's left or right? Yes, of course. And the easiest way to do that is look at the glenoid here. This will always be lateral. This will be a lateral structure. And here, this will always be medial. This will always be medial. This is actually the medial border of the scapula. So which side is this? So if you're looking at it, you're actually looking directly through this person. This is the left scapula. This has got to point to the side that it is on. Next, we have the clavicle. Okay, this is your collarbone. Most of you can feel this bone. Itself. Okay, it's a very simple bone. You do have to know if it is left or right. Easiest way to do that is to look at this guy, this little flat piece right here. This is what's called the acromial end, and this points to the side at which it is. So again, this is a left clavicle. Left clavicle. Now we're going to look at the humerus. Okay. There is our humerus bone. So you take a look at it. The humerus bone. So you do have to know its side. You have to know what side the humerus is on. So there are a couple ways you can do this. There are a couple ways you can look at the humerus itself. Again, I do it two ways. So there is a large fossa right here. But if you go to the anterior portion, there is a smaller fossa right here. The larger fossa, called the olecranon fossa. It is posterior. Okay, so it is posterior. So this has to face the back. Okay, and then we have up here the head. This is the head of the humerus right here. This always has to point medially. This points medially. So this guy is going to be arranged like this. Okay, which makes this is the right humerus. The head is pointing medially, and the olecranon fossa back here is pointed posteriorly itself. So the structures of this that I definitely want you to know. Of course, we've got the head. Now, if you look at the way that the head is orientated, and you look at the way the glenoid cavity is orientated, this isn't anatomically correct. I'm just doing this to demonstrate how they fit. The head of the humerus is much too small for the glenoid. by far. And so what this does is it gives us an excellent range of motion, as you can see, but very poor stability. Okay? And that's the trade-off you're going to make. You're going to make the trade-off between range of motion and that of stability. Okay? So the head fits into the glenoid cavity of the scapula. Well, it really doesn't fit. It just sits in the glenoid cavity. So there's the head. Okay. Then we have what's called the neck. We have two necks on this. So you see this little line around the humerus, the head of the humerus. This is called the anatomic neck. The anatomic neck. So small, really insignificant clinically. Then we move down a little bit. In this area here, this is called the surgical neck. This is the surgical neck of the humerus. And the reason it is of clinical significance is this is the most common place that people break their humeruses, okay, by far. Okay. Then we have here, if we look at the anterior portion here, we have two ridges, two bumps. These are called tubercles. So we have a lesser tubercle and we have a greater tubercle. So the lesser tubercle is smaller than the greater tubercle. And then between them we have an intertubercular fossa, and this is where the deltoid tendon runs, right here. And then if we move down the bone here, this guy here, this is the deltoid tuberosity. It's this rough patch here. It's where the deltoid muscle actually sits. This is where the deltoid sits. Okay. And then moving down, we have our condyles. So if we look at the inferior structure of the humerus itself, we'll tilt it up like this so you can see. Okay, you have condyles. Okay, these are these rounded structures that allow for articulation of the humerus. Of the humerus to the radius and the ulna. So medial and lateral. Okay, so how do I know this? Well, I know this because this condyle right here, this is medial. Remember, the head of the humerus is medial. And this pointed epicondyle, this is the medial epicondyle, points inward. And then if I have a medial epicondyle, that means I have a lateral epicondyle itself. So condyles, epicondyle. So this is the medial epicondyle. This is the lateral epicondyle. This is the medial condyle. This is the lateral condyle. So if we turn this guy over, turn the humerus over, so you can again see here, this is the medial condyle. This is the medial epicondyle, because I'm looking at it from a different perspective. This is the lateral epicondyle. This is the lateral condyle. The last thing I want you to definitely know here is this. This is called the olecranon fossa. The olecranon fossa. Okay. So, which brings us to our next two bones. We have the ulna. And we have the radius. So the ulna is the medial of the two forearm bones. It is the medial of the two forearm bones. Okay. Here, sits in there. So you can look at here, olecranon fossa. Ulna sits in the olecranon fossa. Just like that. Which means that this guy here is the olecranon process of the ulna. So this whole thing here is the head. This is the head of the ulna. Okay. So then on the side of the ulna, we have the radial notch. This is where the radius articulates with the ulna itself. And the last thing I want you to remember is this sharp stick right here. The sharp stick. This is called the styloid process of the ulna. The process of the ulna. So this is how we fit together. Medial. Okay, and then we have our other bone. It's called the radius. Okay, so the radius fits laterally. This is actually backwards. So the radius is the lateral of the bones. And the way these two work together, lateral of the bones, so this would be medial, this would be lateral, it's on the inside. And the way these two stick together is it kind of like this. Okay, and so what the radius does is it rotates around to go from a pronated angle to a supinated angle. So when it's supinated, the radius actually crosses over the ulna. When I'm pronated, the radius crosses over the ulna. When I'm supinated, the two bones are open to each other. Okay? So the only structures I really want you to know about the radius are the head, the neck. Okay, so I have a head, I have a neck, and again here I have a styloid process. So that's the radius. And then lastly we have the hand. Okay. So the thing we need to know about the hand are the bones. Okay, thank goodness you don't have to know all of the bones. You don't have to know them all. So I'll hold them up like this so you can see. So you have two layers of bones here. Okay, there's 4 bones and then there's 4 bones. And what these are called the carpal bones. They are the carpal bones. Carpal means wrist. And then these bones here, the bones of your palm, these are called the metacarpal bones. The metacarpal bones themselves. Then, after we have the metacarpal bones, okay, we have the digital bones. Okay, I know in the book everybody calls these phalanges, but these are actually, we now call these digitals. Phalanges are the toes. That's how I distinguish them now. So the numbering structure is what I really want you to get at. I want to make sure that you understand how to number these guys. So the thumb, this guy right here, and how do you know it's the thumb? Okay, the thumb only has a metacarpal and it's got 2 digital bones. Every other finger has a metacarpal and 3 digital bones. So that's how you can tell the difference. Is it a thumb or is it a finger? That's how you do it. So the thumb is always digit 1, and then you just move down the hand. Digit 1, digit 2, digit 3, digit 4, digit 5. Now you have to determine, is this right or left? Is this right or left? Well, how you do that is you have to make sure we are in anatomic position. So you're like, well, how do I know I'm in anatomic position? And the easiest way to do it is you see this thing right here, this little process. If this is sticking up, if this little process right here sticks up, you are looking at the front of the hand, okay, in anatomic position. You are looking at the hand. Actually, you are looking at this hand right here. So this is the left hand. Okay, so this is my left hand, just like that. So that's how you know. Okay, you see these guys sticking up. And when you take the practical, you can actually move these guys around. You know, I'm fine with you touching it, so do that. So if this guy is sticking up, you are looking at the anterior portion of the hand. That would make this the left. So then 1, 2, 3, 4, 5. The number, so if I said this would be the first metacarpal, second metacarpal, third metacarpal, fourth metacarpal, fifth metacarpal. Now it gets confusing when you start talking about these guys. 1, 2, 3. 1, 2, 3, 1, 2, 3, 1, 2, 3, only 1, 2. So here, these are called the digital bones. So we have proximal and distal. Proximal, distal. Proximal, closer to the point of attachment. Distal, farther away from the point of attachment. So again, now we have 3 bones up here. So we have proximal, distal, and intermediate. So we have proximal, closer to the point of attachment. Intermediate, here, and distal. So how you would do this is this is first digit. So how you'd name this is this is first proximal, digital bone. This is first distal. Here, this is second proximal. This is second distal. This is second intermediate digital bone. Third proximal, third distal, third intermediate. Fourth proximal, fourth distal, fourth intermediate. And then fifth proximal, fifth distal, fifth intermediate. Okay? So those are the bones of the hand. Right?